Om Shri Manjunatha Namaha. Good morning, everyone, and welcome to today's session on Social Samhita Adhyayana. Without further delay, I would like to call upon Dr. Murthy Sharma sir, STMC AODB, to take over the session. Welcome to you, sir.
विपरीत अविपरीत व्रणविज्ञानीयम् अध्यायं व्याख्यास्यामः इति अस्माकं कुर्वन्तन्वन्तरिः. The next is about the prognosis of the disease. Shrishta gives a high importance to predict the prognosis of the disease and prediction of the death. So in the consecutive next 5-6 chapters, you will have different modalities of predicting the prognosis. Now, in this chapter, it's about, though the title is about vrana vijnania, the prognosis of the wound, vrana, it's many of the principles are applicable to all the conditions and predicting about the life of a patient, also predict about the death too. फलाग्नि जलवृष्टीनां पुष्पधूमाम्बुदायतः ख्यापयन्ति भविष्योक्तं तथा अरिष्टानि पञ्चतां तानि सौक्ष्म्यात् प्रमादात् वा तथैव आशु व्यतिक्रमात् दृश्यन्ते न उद्गतानि अग्निः मुमूर्षोः न तु असम्भवात् ध्रुवं तु मरणं दृष्टे. Now Arista Lakshana is a sign of a probable this death or possible death. So are predicting the life expectancy of a patient. That's the issue. Now, according to Sushruta, every this death would have some premonitory signs. So, premonitory signs of the death and prediction for death is a very controversial issue. We will deal with those issues at different levels when we go into the consecutive chapters. Today also we will be discussing certain of the relevant issues about that. Now, according to Ayurveda, the death would always have some premonitory signs, and those are considered as the Arista Lakshana. And according to Sushruta says, there will be essentially a Arista Lakshana, but at times you may miss those Arista Lakshanas because either they are mild Saukshmyat or Pramadadva because of your confusion or you are not able to identify that, or Vyatikramat because of treatment. The Arista Lakshana might not be identified, but every person who is going to die would have a Arista Lakshana, some signs which could be identified before death. That's one of the important concepts of Ayurveda. And comparatively, that kind of concept in the contemporary science we will deal with at different levels when we go into the consecutive chapters. Now, Brahmane tat kila amalaihi rasayana tapo jape tatpare animaryate. New Arista Lakshanas can be prevented or avoided or they can be nullified, neutralized by a knowledgeable person. Now, Brahmana doesn't mean only Brahmana caste. It's about persons who know, who have the knowledge, medical persons, and who have a very clear-cut idea about the concepts and who are dedicated to that. And when they intervene with the treatment, it can be prevented. Now, in the contemporary science about prediction of the death, possible death, there are many issues. Now, one of the issues or methodology or a protocol which is quite common used in ICUs is the Apache technique, or Apache is acute physiology and chronic health evaluation methodology. Now, this is based upon certain physical parameters. Now, the whole controversy is whether a imminent death can be predicted or not. Now, imminent death can be predicted. Now, lots of issues are there. We will be going into those different issues in due course of time. But one of the very popular and a regularly used technology is the Apache technology. And that's about the patients who are in ICU treatment, how to predict about the total outcome irrespective of the disease. And this there is a scaling of the possible death issues, and there you have the parameters like temperature and mean arterial pressure, heart rate, respiratory rate, oxygen, oxygenation, arterial pH, serum sodium level, potassium and creatinine level, and in case of renal failure, the score would be double, and then hematocrit value and Glasgow coma scale, and that's about the different levels of the scores like 1, 2, 3, 4, 0, 1, 2, 3, 4, the scales depending upon the rates as this is a standard list. And in a patient, maximum could be up to 75. 75 scores could be there. Depending upon the total score, Apache score, you can predict about the outcome. And of course, the other factor is about the age. Now, when I say age, it also depends upon the possible expected life period of the person, depending upon the geographical areas and other variable factors. So, when you have these multiple factors together, you can predict about the life of the patient. Now, if you find this calculation quite difficult, then you have now assistance of online assistance, where you have ready-made calculators online. In this website, if you put in the data into these columns, you can get the total Apache score and then can predict about the possible outcome in ICU. So this is a very popularly used technology in ICU monitoring patients, and quite useful to a certain extent. Now, the other factors, when I said about the age and the expected life period, as per the data, the expected life period is increasing year by year, and there is a sudden spike in the expected life period at two events, one 18 and 91, when the vaccination was introduced, and the concern about the environment and lifestyle, diet, etc. they were aware of. And 1951, that's the time where the expected life period is increased. So life period expected life expectancy is increasing up to about 100 years, maybe by 2050. This is about the possible percentage of the people who can live up to this period. So by this time now, this is global, it's around 2020 or 22 area. The expected life period is around 80 plus globally. 82 is the year as such. Now, in due course of time, it may just get reduced. That's the future expectancy. Is the expected life expectancy could be reduced due to the possible pollution, which is not controlled. Anyway, the issue is, when I say that age as a factor to be added in case of Apache score, this has to be considered. The expected life scale in the particular country or the place where the person is living. Now, life expectancy in the global area, again, this also is a WHO data. According to the data of many years, like the life expectancy of less than 50 years in a few of the countries, like underdeveloped countries of Africa, whereas more than 85 years in the developed countries like USA and Australia. India comes somewhere in between, where the expected life period now at present this years is 72 years and 42 days. That's the expected life period. So that's one way of predicting the possible death. Now, that's about the patients in ICU. Now, in others, in a otherwise apparently healthy person, a deterioration of the DNA and DNA methylation clocks, that's the changes in the DNA, which is a sign of the aging, can be identified, and that there is a technique of assessing the chronological, as per the time period, as a standard method of expected changes in the DNA, and then biological epigenetic clock changes in the DNA, they can be compared, and a possible prediction of the death is a model which is being tried and which is becoming popular. Still, it has not become very popular, but this technique may be one of the methods of predicting the possible death. So when I say Arista Lakshana, it may not be only the clinical symptoms, as Charaka or Sushruta has said. You may come to a level where you may have an objective prediction of the death, but this method of DNA methylation clock technique has not yet become fully operational, but it's promising and it's being studied as such. Now, once the prediction is there, now the next is about how to prevent and how to manage. नक्षत्र पीड़ा बहुधा यथा कालं विपद्यते तथैव अरिष्टपाकं च ब्रुवते बहु जनाः. Now, Sushruta doesn't accept this version, but he says majority of the people would consider that there is a impact of the celestial bodies like Graha, Nakshatra, and as well as the Kala season, which will produce the Arista Lakshana, and the termination of that Arista Lakshana, end of the Arista Lakshana, would be impacted by Nakshatra Peda, as according to the majority. This is what Sushruta says. Sushruta doesn't give much stress on this aspect. Now, that's again a controversial issue whether the celestial bodies, Graha Nakshatras, would have an impact on the life of the person or not. That's a controversial issue. But from Indian mythology point of view, and according to our traditional beliefs, there is an impact. That's all the point. We will not go beyond that. Then asiddhim apniyat loke pratikuruvan gadayashah ato arishta niyatnena lakshayet kushalobhishaka. If you do not identify the arishta lakshana, and if you go on treating the patients, then without predicting the prognosis, then your skill may be going waste. Asiddhim apniyata, your skill will go waste, and hence for a physician it's quite necessary to predict the prognosis accurately. So prediction of the prognosis accurately is one of the important issue in the medical management of a patient. Even now it's true the same thing. So there are lots of methodology, lots of these guidelines to predict the prognosis of a specific disease and in general. Now, whatever I have mentioned about that acute physiology assessment and chronic health evaluation techniques, that's about the ICU patients. Now, with other conditions, you have many more methods which will come in due course of time and we go into the consecutive chapters. Now, Gandhavarnasadinam Visheshanam Swabhavatah Vaikrutam Yattadatasya Praninapakwalakshanam. In case of the Vrana, the main changes are about the changes which could be seen in the smell, the color, or the rasa, taste of the person, by which you can predict about the outcome. Now, the gandha or the smell which can occur. Now, Sushruta says about the two aspects. One, the natural odor present in the breath. Now, this is about the odor present in the breath as well as in the wound. Now, in the context of the Varana Pariksha, we have discussed about that the possible smell of the wound and then what can be the consequences as such. We have discussed that in the previous chapters, the different varieties of the smell which are related to the organisms as well as which can predict about the possible the disease conditions. Now, in this chapter, Sushruta refers to the smell which is related to the wound as well as the smell which could be present in the surroundings of the patient. The breath of the patient also can be considered as a parameter to assess the prognosis. Now, Katuhu Tikshnascha Vishrascha Gandhastu Pravanadibihi Lohagandhistu Raktena Vyamishras Sannivadgaha Laja Atasi Taila Samaha Kinchit Visrascha Gandharaha Jnyayaha Prakriti the smells like somewhat katu smell. Now, when I say katu, pungent smell in the sense something like a mild ammoniacal smell, not very severe. A severe ammoniacal smell is suggestive of something else. Or visraha, again, somewhat odor, that's what we call as the sweat odor. These could be sign of pavana, vata prakopa or vata acid, and the pitta would be presenting with lohagandhi, metallic smell, and raktenvamshra, bloody smell, and the kapha would be producing atasi tela like smell or laja like smell. That fried rice like smell is considered as the natural smell. Now, in a human body too, if you look at try to smell the breath or maybe the sweat of a person, you will find every person would have some individual character of the smell. That's depending upon the volatile chemicals, organic chemicals which are emanated from the body, either in the form of the breath, or it could be in the sweat acid. Now, based upon that, analysis and then diagnosis of the disease conditions also are possible. Now, according to Sushruta again, Sushruta says these are the smells which are considered as a normal. The katu or lohgandhi or lajatasi laika, they are considered as normal variations which could be depending upon the vata pitta kapha prakriti of the person. A gandha vaikritam, the abnormal smells which could occur could be madhya, aguru, adya, sumana, padma, chandana, champakaihi, sagandhaha, divyagandhascha, mumurshunam, ranaha, smraha, shwavaji, mushikadbhakshu, पूति वल्लूर मत्कुणैः सगन्धाः पङ्कगन्धाश्च भूमिगन्धाश्च गर्हिताः. The smell of alcohol or aguru or maybe the ghee or the flowers, particularly jasmine flower, and or maybe the lotus flower or chandana like smell. Now, important, the sandalwood like smell or in some of the Divyagandaha, very pleasant smell, also could be a sign of a fatal conditions, serious complications. Fruity odor in case of ketoacidosis is also a sign of a possible serious complication. As that's what Sudha suggests about. The pleasant smells also could be a sign of serious conditions or fatal conditions. At the same time, unpleasant smells like Shobhaji, Mushika, Dhvansha, Puti, Vallu, Ramutkari, like the horse's smell or smell of a horse's urine, or the rat's urine smell, or the wild animals smell like that kind of a smell, or Pankagandaha, the decayed or dirt, smell of a dirt, or smell of the earth. These are considered as Garhita, could be affecting asset. Now, assessing the smell or the breath analysis, assessment of the breath with the chemicals or chemical means or maybe the sophisticated instruments is one of the evolving technologies of the present day, and lots of you will find plenty of articles, research articles of where these kinds of studies are done, and the attempt to make the diagnosis of different systems, particularly the oral pathologies, diseases of the oral cavity, diseases of the respiratory passages, liver diseases, kidney diseases, GIT diseases. These are certain of the areas where the impact of the study of this is possible, and in future it could be a model. At present, the breath analysis or breath tests are done for diagnosis, and which are quite prevalent, which are very prevalent in throughout the clinical practice throughout the global, are to predict about the alcohol consumption, certain of the poisoning substances, pylori, H. pylori infections. Confirmation of the diagnosis with the breath is a very standard protocol now. Lung cancer and ketoacidosis, these are established. With other diseases also, such methodology is now being established, being practiced, and particularly to study the different organisms, a models of this is being becoming popular, and in a very short period, identification of the organisms may with the breath test and naming the technique as a breath biopsy is a very new trend, and it may become very popular, and in a few years this kind of a facility may be available everywhere. Though at present, the these global or available techniques are limited to these conditions: alcohol poisoning and pylori infections. With the other infections, these methodologies have developed and are becoming popular elsewhere. And in a few years, it's quite possible to identify the microorganism flora in the body by assessing the breath, and that technique is called as breath biopsy assay. You will have plenty of literatures. Those who are interested in studying this, the current literature, I have given you a few of the references where these trends are suggested, and the possible success rate and accuracy and sensitivity of these tests are studied. So that breath analysis or breath biopsy technique has become a possible future technology asset. Now that's about the smell asset. The next part is the varna, color. Kunkumadhyama kangusta savarnaha pitokoparaha nadashyate nachushyante vishattan parivarjayata. A patient with a pitta ulcer where the color would be of pitta suggestive, and where again it will be bright red color. Now as far as the colors of the vrana and the dushta vrana, we have discussed that in the previous chapter. But in the context of pitta vrana, in general, a pitta vrana would always have more severe burning sensation, as well as it tends to get separated. Now, if a wound has signs of pitta vrana, like the color is reddish, but doesn't produce the burning sensation, and there is no question, there is no evident suppuration, in that condition, the prognosis is poor, or it can result in a serious complication. This is a very interesting issue. From the practical clinical point of view, uh, I would refer to patients presenting with the osteosarcoma. Osteosarcoma is well known to present with all the clinical signs of an inflammatory wound. The local temperature may be slightly raised, and it may have that bleeding. So, from all the practical clinical point of view, it may show the signs of pitta vrana, but it's a tumor pathology, and handling that could be quite critical, and hence it is quite important to differentiate between a sarcoma ulcer and a wound otherwise, a infected wound otherwise. So general protocol is whenever there is a signs of inflammation in an area where it is close to the bone and relatively deep-seated or indurated, you have to rule out osteosarcoma. That's a general guideline in case of the wound management. So that's what Sushil suggests. Like when a wound has evidence of pitta dosha drusti, but it doesn't separate, then you have to be careful. It could be one of the possible serious condition. Kandumantah sthiraah shwetaah snigdaah kapalipitaah duyante vapidashyante vishaktan parivarjayat. Otherwise, kapaja lakshana, where the seed conditions would be having somewhat itching and it is firm and fixed. But if it shows a signs of suppuration, then that's a sign that the prognosis is poor. This is evident in case of diabetic carbuncle conditions. Carbuncle conditions, when they present initially, they would be painless, they would be hard, and they will always have a typical features like a cold lesion, like the local temperature will be comparatively lesser in the beginning. But later, once there is a change there, it will be suddenly getting suppurated, and then you will have all the clinical signs of necrosis. Now, this is exactly this what Sushila means by a wound or a lesion which looks like a Kapaja lesion. If it results in suppuration and then severe burning sensation, then it could be a sign of a poor prognosis there. कृष्णस्कीय तनुस्रवा वातजाः मर्मताकिनः स्वल्पामपि न कुर्वन्ति इदं तान् परिवर्जयितम्. A wound or a lesion which is black in color and tanusrava where there is not much of a secretion, and so that it will always have the features of the vataja vrana but doesn't produce pain, it's painless, then that also is a poor prognosis. That's very evident in case of a gangrene. In an ischemic ulcer, in the ischemic condition there will be pain, but once it has become gangrenous, the tissue is dead, there will be no pain. So absence of the pain in a case of ischemic pathology is a sign of poor prognosis. Evidence of suppuration in a relatively cold and less indurated condition is an evidence of poor prognosis, or a absence of the suppurative changes in a hypergranular wound, or where you will have that bleeding and then the features of Pittaja, that too is a poor prognosis. Now, this is a very important issue, a serious or a very keen clinical observation which is suggested there. Now, Kshvedanti Gurgurayante ज्वलन्तीव च ये व्रणाः त्वं मांसस्थाश्च पवनं सशब्दं विसृजन्ति ये च मर्मसु असम्भूताः भवन्ति अत्यर्थवेदनाः. Now, Sushil has used two words, Kshvedanti and Gurguray. According to Dhala, the word Kshveda means kata kata shabdam kurvanti. When a wound will have some sounds produced as you move about, that's the Kshvedanti. So Kshvedanti word is a very specific word used by Sushruta, which is not very popular in Sanskrit literature. Gurghurayante, where there will be sounds, and Sushruta Dhalana uses the expression like Gurghurayante is a स्वमार्जरादीनां कोपाद अंतर्गत शब्दो गुरुकुला शब्दः उच्यते. When the dogs or the cats, they would have some sounds produced from their throat when they are very angry, some gurgur sound. That kind of sound is the gurgura. So a wound which produces the sounds, and when I say that wound which produces sound means there is some moving part, particularly moving hard part, very often related to the bones. If there is a fractured piece of the bone, or if there are any other solid foreign particles in a wound, that can produce the sounds. Or even if there are gas bubbles in a gas gangrene too, there could be sounds produced. So a sound produced in a wound is a sign of poor prognosis. Jalam jivate vranaha tvangmamsastasya pavanam sashabdam visrjanti. When there is a release of gas, now gas releasing conditions, we have discussed that in the previous sessions when we discussed about the asadhya vrana lakshanas. Now again repetition. Whenever there is a condition like a gas production in the wound in case of gangrenous condition, gram-negative infections, gas gangrene is well known to have a poor prognosis. Or if there is a fecal fistula, a gas wound connected to either the viscera of the abdomen or connected to the respiratory tract, when there is a flow of the gas, in that condition, it's quite important to ensure that there is no distal obstruction. Do not manage that gas leakage. That's what we have said. But that's again sign of a poor prognosis. And a wound which is not located in marma but produces severe symptoms which looks like that of the marma with the lakshana, that too is a sign of a poor prognosis. दश्यन्ते च अन्तरत्यर्थं बहिः शीताश्चर्यव्रणाः दश्यन्ते बहिरत्यर्थं भवत्यन्तश्च शीतलाः. Those roots which will produce severe burning sensation at the deeper level, but on touch there is on this palpation we do not see that raise in the temperature, or the other way when there is a wound with the severe temperature raised over the area, but within the patient feels coldness, that's sign of a poor prognosis. Now a situation of this condition where the external temperature is raised but the internally the patient would feel cool is in case of ischemic conditions, whereas Dakshinte Bahiratyartham, this is about the ischemic conditions where the patient would feel the coldness inside, but there is a local temperature may be raised. When the locally cool is there and the internal temperature is raised, that's in case of septicemia. In septicemic conditions, you will have that kind of situation where the core temperature may be reduced in severe conditions, and that's always a sign of a poor prognosis. Now, according to the shapes of the wound and then evidence of some abnormal substances deposited over the body, again prediction of the prognosis can be done, and that's what Sush says. शक्तिध्वजरथाः कुन्तवादिवारणघोषाः येष्टापि अवभासेरन् प्रासादाकृतयस्तथा चूर्ण अवकीर्णा इव ये भान्ति चा अनवचूर्णिताः. Even without having any churna applied, if the wounds are over the surface of the body, you see certain shapes which as if they are having some dust applied, or when you see some lesions which have certain resemblances like shapes like Shakti Dvajarataha, something like the cards or flags and so on. So different shapes seen over the surface of the body, that's always suggestive of a poor prognosis. Now, in case of collagen tissue disorders, you will see there is a subcutaneous hemorrhagic spots. When the collagen tissue has become fragile, it can occur. Now, in case of purpura-like conditions, is a cause of the disease. But in a non-purpurous patient, if these kinds of lesions do occur, that could be a sign of imminent septicemia. In imminent septicemia too, a collagen fragility could occur. Or in chronic liver diseases, a collagen fragility and having these kinds of reddish patches seen in the body, and the reddish patches could be of different shapes. Sushruta has given certain standard shapes like the shapes of vehicles, shapes of weapons, or shapes of home, houses, and so on. Now, this is attributable by anyone by imagination, but different shapes of these lesions could occur in case of the subcutaneous hemorrhage conditions. And in a non-purpurous patients, it's always suggestive of a severe pathology where either the collagen tissue synthesis is affected or the collagen tissue stability is affected, and that could be an evidence or a sign of poor prognosis. प्राणमांसक्षय श्वास कास आरोचक पीडिताः प्रबुद्ध पूय रुधिराः व्रणाः येषां च मर्मसु. A wound which produces emaciation or which also can produce respiratory complications, gastrointestinal tract complications, that's again suggestive of a septicemia. All these signs of the septicemia, a wound which can produce the septicemia and which will also have purulent, severe pus discharge or there is significant bleeding, that too is considered as a asadhya. क्रियाभिः सम्यगराब्धाः न सिद्ध्यन्ति ये व्रणाः वर्जयेत्तानभिप्राज्ञः संरक्षन् आत्मनो यशः. Even after following a standard protocol of the treatment, if a wound doesn't get doesn't show a clinical response, then too that's considered as an asadhya vrana, and that's how you have to be careful in managing the wound. This is what Sushruta says in this chapter. इति सुश्रुत संहितायां सूत्रस्थाने विपरीत अविपरीत भ्रमज्ञानीयो नाम अष्टाविंशतितमोऽध्यायः. Prediction and prognosis and mortality based on the clinically perceptible signs is a unique concept of Ayurveda, and this is applicable to every condition, not only simply about the vrana wound, it also is applicable to other conditions. Now, the next chapter we will continue with the Viparita, Aviparita, Swapna Nidarshaniyam Adhyayam Vyakhyasyanah. Now, prediction of the prognosis is studied by Sushruta at different levels as such. Another parameter by which the possible prediction of the disease is by having the analysis of the dream analysis, as well as the other signs which we call as a shakuna. Uh, Now, this is something like subtle. From the contemporary science point of view, this seems to be something like intuitional as such. So there is a lot of criticism on this part. Now, whether it is really true or not, that's another issue. But we will have to look at the issues of studying the possible prognosis based upon certain extraneous issues like the dreams or the dosa lakshanas, etc., are depending upon what the messenger would say and how the messenger would convey. These are all the features which look like subtle. But anyway, we will have to look at it in a critical view. Now, Duta Darshana Sambhasha Veshaha Chestidamemaja Riksham Vela Tichishtiva Nimittam Shakunam Anilah Desho Vegya Vagdeha Manasam Vichestam Kathayantya Atragatam Shubham Va Yadiva Ashubham. Now, based upon the messenger who gives the message about the disease to the physician. Now, in those days, the method of dealing with the patient would be the patient would be at his home, the physician would visit and visit the patient after getting a message. Now, based upon the messenger's behavior, his dress, you can suggest about or measure about the possible seriousness of the disease. That's one of the ways of having a concern about the disease condition. When a patient's attendant comes in a hurry without taking care of his personal appearance, it can be an indirect evidence that the condition is really serious. Whereas a messenger comes very comfortably, it's quite possible that the condition is not so critical. So based upon that part, the how the messenger would come and the time in which he comes in and his anxiety level of his anxiety could be a parameter by which you can predict about the prognosis as such. Now Sushruta adds one more shakuna, as that word shakuna is again a very specific word used in Sanskrit literature. The Shakuna is that word which can help in Shubha Shubham Vidyatum Anenati Shakunah. Vyadhi Shakunik. Now, so that's the issue. Though that Shakuna is not very easily accepted by Sushruta, those who depend upon the predicting the prognosis or predicting the outcome or future based upon the Shakuna are called as Shakunika. Sushruta says that Shakunikas are those who are depending upon that Shakuna prediction. They are not to be treated. They are to be kept outside your treatment protocol. Still, Sushruta suggests about the Shakuna in the context of the prediction of the disease. So, it's a bit of controversy. Sushruta doesn't believe in Shakuna but accepts Shakuna to a certain extent in certain issues. Now, depending upon the status or status of the mind, status of the body of the physician, the outcome to the patient can be predicted. This is again a very big question mark issue, how far it is true or not. But based upon the clinical experience, we can say certain situations this may be practically true. Now, about that Shakuna and Shakuna Shastra, as well as the possible prediction of a outcome based upon these extraneous factors, there is a lot of literature. I will not go into that literature, but if at all anyone is interested, there is a very detailed Shakuna Shastra which is published in India from ancient literature, where you will have lots of issues relating about the prediction of the prognosis, a whole publication as such. Or from the Western point of view, you also have lots of such books, and one of the very interesting book is Science of Omens and the Knowledge of Heavens. This is one interesting book. I don't say that that's related to medicine, but it's a general interesting book where you can know something more about this Shakuna and that prediction and outcome as such. Now, the again a bit more detail about that, how the character and the appearance of the messenger would be producing the signs. पाखंड आश्रम वर्णानां सपक्षाः कर्म सिद्धे सैव विपरीता स्युः दूराः कर्म विपत्तये. Now, if a pakhandi is Trayudharma tam khandayati ite pakhandi. Trayudharma is the Vaidika dharma. If that a person who criticizes that Vaidika dharma comes as a messenger about the disease, from disease, Sushruta says that could be a sign of a possible outcome, this negative outcome of the patient. So the again issue is a controversial issue. How far this is applicable now or not, I am not going to that part. We will read it and study it as mentioned by Sushruta. So depending upon the attitude and the this philosophy of a messenger, the disease outcome of the disease of a person, whether it can change or not, big question mark. नपुंसकं स्त्री बहो नैककार्याः सूयकाः गर्दभ ऊष्ट रथप्राप्ताः प्राप्ता वा स्युः परम्पराः वैद्यं ये उपसर्पन्ति दूतास्ते चापि गर्हिताः messengers who are napumsakas, who are of the bisexual type, or stree. Even in those days women would be always preferred to avoid that movement, so may not be relevant now. These issues may not be very practically relevant now, but we just study it as what Sushruta says. So females coming as a messenger is also a sign of anxiety or severeness of the disease. And Naikakaryaha, those who have other multiple jobs, but somehow they come in between and then approach the doctor, are Asuyakaha, those who do not have a proper approach, they will be having some negative attitude. And those who come in vehicles like Gardava Ustra Ratha Praptaha. Now in those days, the usual standard would be coming on a horse or these vehicles. But if a person comes on donkey or maybe a camel, which are not conventionally used as the vehicles in that day, now you may think of unconventional vehicles, like unconventional means of transport, which are used like, and such conditions could be suggestive of a poor prognosis. Of course, we will not go into much of the details of that issue, and there cannot be much analysis as such. Question mark like whether they are relevant now is a big question mark, may not be very directly relevant in the present situation. आशदण्डायुधराः पाण्डुर इतरवाससः आर्द्रजीर्ण अपसव्य एकमलिनः उद्भस्तवाससः न्यून अधिकाङ्गाः उद्विग्नाः विकृताः रौद्ररूपिणः रूक्षनिःस्वरवक्तारः अङ्गल्प अभिदायिनः. Now, those personality of the messenger is another of these factors, and Sushruta gives about such of the issues. Those patients, attendants who come with the weapons, pasha, danda, etc. In the present day situation, the issue is about possible attack on the medical personality, which has become a very burning problem. But again, it's not a direct relationship. It's just we'll read it casually. Pandura Itaravasasa, those who wear the dress with the color other than that of the white color, or those who have the worn out clothes or do not have a proper dressing material. Apasagya is the proper improper dressing, like buttons which are not applied properly, the upper button and lower button, they are mismatched and so on. So Marina Udhastavasas, those who do not have a clean cloth, are those who do not have they would have some abnormalities of the body, physical abnormalities, Nyuna Adhikangaha, are those who are having very severe anxiety, or those who have harsh behavior. These are considered as the messengers of this kind of issues are considered as poor signs. Now, how the messenger behaves when he is waiting for the doctor is another of the sign by which a shakuna can be predicted or the output be predicted. Chindan tatra kastani spushanto nasikam stanam वस्त्रान्त अनामिका केश नखरोम दशास्पृशः स्रोतो अवरोध हृद्गण्ड मूर्ध उरकुक्षिपाणयः कपाल उपल भस्म अस्थि तुषांगार कराष्टे विलिखन्तो महीं किञ्चन मुञ्चन्तो लोष्टमेधिनः तैल कर्दम दिग्धांगाः रक्तस्रग अनुलेपनाः फलं पक्वम् असारं वा गृहीत्वा अन्यत्र तद्विदं नखैः नखान्तरं वापि करेण चरणं तथा उपानच्चर्महस्ता वा विकृतव्याधिपीडिताः वामाचाराः रुदन्तश्च श्वासिनो विकृतेक्षणाः यां यां दिशि प्राञ्जलयो विषम एकपदे स्थिराः वैद्यं ये उपसर्पन्ति दूतास्तेऽपि चापि गर्हिताः. So such a behaviors where the patient, the attendant would show some anxiety, and those anxious behaviors are described in Sushruta. Of course, the like not a very major issue. A person who touches his nose frequently or the breast frequently, or who just cuts some grass or certain materials in the hand, or goes on touching the different parts of the body continuously, and are those who are holding these various substances like bhasma rashi, ashes, or tusha, grass, etc., or these skin of rice, etc., are those who are scratching over the surface of the body, and those who are having just twisting or rubbing their hands together with the nails held as such, or those who are standing on one leg, and so on. So these are all the possible different changes which show the evidence of anxiety in the patient. So we'll have to look at that issue, like persons who show severe anxiety, that will be suggesting of a poor prognosis. दक्षिणाभिमुखं देशे तु अशचौ च हुताशनं ज्वलयन्तं पचन्तं वा क्रूरकर्माणि च उदितं नग्नं भूमौ शयानं वा वेगोत्सर्गेषु वा शुचिं प्रकीर्णकेशमभ्यक्तं स्विन्नं विक्लवमेव च वैद्यं ये उपसर्पन्ति दूतास्ते चापि दर्शिताः. Now, in the Indian tradition, the southern direction is always considered as inauspicious, signs of death, and Yama is supposed to be in the southern direction. So those who come face towards the south and then talk to a physician, they are considered as a sign of poor prognosis. Or those again, these are all about the behavioral changes, like a person who doesn't have a proper or a standard social customs, who doesn't follow social customs as such, or who do not take care of his body, they can be signs of the possible complications. वैद्यस्य पैत्रे दैवे वा कार्ये च उत्पातदर्शने मध्याह्ने च अर्धरात्रे च वा सन्ध्ययोः कृत्तिकासु च आर्द्रा श्लेष्मा मखा मूलपर्वासु भरणीषु च चतुर्थ्यां वा नवम्यां वा षष्ठ्यां सन्धिदिनेषु च वैद्यम् उपसर्पन्ति दूतास्ते चापि दर्शिताः. It also depends upon what the physician would be doing. If the physician is doing some auspicious work like worshipping his god, or maybe having some dealing with his ancestors, that Shraddha karma is being done, or those who come at inauspicious times like the day, mid of the day or mid of the night, or certain specific nakshatras or dates like Ardra, Shleshva, Makha nakshatra, etc., Bharani Kritika nakshatra, or Tithi, Chaturthi, Navami, Shasti, these tithis, if the messenger approaches the Vaidya, that also is sign of poor prognosis. This again is a controversial, we will not go into much of that. भिन्न अभितप्ताः मध्याह्ने ज्वलनस्य समीपतः गर्हिताः पित्तरोगेषु दूताः वैद्यमुपागताः तयेव कफरोगेषु कर्मसिद्धिकराः स्मृताः एतेन शेषं व्याख्यातं बुद्ध्वा संविभजेत्तु तत् रक्तपित्त अतिसारेषु प्रमेहेषु तथैव च प्रशस्तो जलरोधेषु दूतवैद्यसमागमः विज्ञाय एवं विभागं तु शेषं बुद्धेत पुण्डितः. Depending upon the dosha of the disease again and the environment or the surroundings of the physician and the messenger's interaction, the prediction could be predicted. Like in a patient of Pitta Vyadhi, if there is a hot season, a patient comes in a very hot season, that's not a sign of good sign as such. Whereas if it is a Kapha Vyadhi, if a patient comes in a hot situation, that's a sign of a better prognosis. Or Raktapittatisara, etc. In these diseases, if there is a sign of a lack of rain, absence of the rain, that's a sign, good sign. This way, depending upon the clinical symptoms of the disease and then environmental factors, you can predict about the prognosis. शुक्लवासरः शुचिः गौरः श्यामो वा प्रियदर्शनः स्वस्यां जातौ स्वगोत्रो वा दूतकार्यकरस्मृतः गोयानेन आगतः तुष्टः पादाभ्यां शुभचे स्थितः स्मृतिमान् विधिकालज्ञः स्वतन्त्रप्रतिपत्तिमान् अलङ्कृतो मङ्गलवान् दूतकार्यकरस्मृतः स्वस्थं प्राङ्मुखमासीनं समे देशे शुचौ शुचिम् उपसर्पति यो वैद्यं सकार्यकरस्मृतः. The signs, good signs are if a messenger comes with white cloth and has kept clean and then looks pleasant and who belongs to the same community of that of the patient, and who comes in a goyana. Goyana is a bullock cart or maybe walking. These are all signs of good signs because they suggest about a lesser anxiety in the patient or patient's part. Or Alankratah, those who has his physical makeup done properly, and Mangalavan Dutaha or Smritiman Vidhikalajna, a intelligent messenger, and when the Vaidya is, physician is facing towards the east, if a messenger comes in, that's always a sign of good prognosis. Like मांस उद कुंभ आतपत्र विप्र वारण गोवृषः शुक्लवर्णाश्च पूज्यन्ते प्रस्थाने दर्शनं गताः स्त्री पुत्रिणी सबत्साः गौः वर्धमानम् अलङ्कृताः कन्याः मत्स्याः फलं चामं स्वस्तिकं मोदकाः दधि हिरण्य अक्षतपात्रं वा रत्नानि सुमनो नृपः अप्रशान्तो अनलो वाजिः हंसश्च आपः शिखी तथा ब्रह्म दुन्दुभिजीमूत शंख वेणुरथस्वनाः सिंह गोपुषनादाश्च हेषितं गजबृंहितं शस्तं हंसवृतं मृणां कुश कौशिकं च वामतः प्रस्थाने यायिनः श्रेष्ठाः वाचश्च हृदयङ्गमाः. Now the signs which could be seen as the physician starts moving towards the patient. Now these are all have to be considered in the context of Sushruta's method of medical practice, where a physician will go to the patient and then examine him there, and as he starts moving, if he is able to see, or if certain these auspicious objects are visible, then that's a good sign. And those auspicious objects like mamsa, udakumbha, that's the pot of water, or atapatra, umbrella, vipra, brahmanas, varana gorushaha, if the cows are seen, shuklavarnasya, if it's a white colored object is seen on moving, or stri putrini, a lady with a child, or savatsa gauhu, a cow with its calf, or the kanyaha, matsyaha, phalam japi, those fruits or so on, swastika lakshanas, modakaha. So these are all the possible signs which could be seen. Or if a person hears sounds like Brahma, Dundubi, Jimuta, these signs of Dundubi, etc., which may not be possible to be heard now, but in those days it was possible, or signs of, or sounds of Simha, Govrishanadashta, lions or so on, which may not be possible now. So from the present day's point of view, this has very less relevance. So we'll just casually read it as such, because we are in a process of reading the Samhita completely. पुत्र पुष्प फल उपेतान् सक्षीरान् नीरुदोद्रुमान् आश्रिता वा नभो वेश्म ध्वज तोरण वेदिकाः दिक्षु शान्ता सुभक्तारः मधुरं पृष्ठतो अनुगाः वामाः वा दक्षिणा वापि शकुनाः कर्मसिद्धये शुष्के अशनिहते अपत्रे वल्लीनद्धे सकण्टके वृक्षे अथवा अश्मभस्मास्ति वीट् तृषाङ्गारपांशुषु चैत्यवल्मीकविषमस्थिताः दीप्तखरस्वराः पुरतो दीक्षु दीप्तासु वक्तारो नार्थसाधकाः पुन्नामानः खगाः वामाः स्त्रीसंज्ञाः दक्षिणाः शुभाः. Now, as you move about, if you can see the trees which have all the flowers and fruits, etc., and where the fruits will also will have the shadow where the persons can be staying in, or when the environment is pleasant, or the persons whom you talk to on the way, if they are having a pleasant behavior, and a person who comes on either the left or the right side, as such, they are considered as the Shubha Shakuna. So this by looking at the surroundings, you can predict the prognosis. Dakshinat Vamagamanam Prashastam Shashtrudalayoho, a dog or a Shrudala, that's a fox, which moves from right to the left side, is considered as a sign, good sign. Vamam Nakula Jashanam Nobhayam Shashasapayoho, if Nakula, that's the mongoose, it passes from the left side to the right side, that's a sign of a good sign. Now these are all again controversial issues, so we will not give much importance to that. If the Shasha and Sarpa have these snakes or rabbits, if they do not move, they stand still, that's a sign of good prognosis. Bhasa Kaushika Yostayona Prashastam Kilobhayam. Eagles and certain birds, they are always a sign of poor prognosis. So Darshanam Vartumapi Godha Krikalaseho, Dute Aniste Tulianam Ashastam Darshanam Radan, Kulatha Tilakarpas, Tusha Pashana Bhasmanam, Patram Nestum Tatangara, Taila Kadam Puritam, and the way if you see Kulatha Tila cotton, these are poor signs, as signs of poor prognosis. Or if you see a vessel containing oil or maybe dirt, that also is a sign of poor prognosis. Or if you see a dead body or palasha, these also are the signs of poor prognosis. Now, This we will continue in the next session because time is up. So we'll, that's only the one issue. Next is about the dreams which we consider. So we'll stop at this level today. We'll continue next session. And with this, we will be just brief as such. There is not much of an issue to be discussed in this issue. If there are any questions, we'll try to answer and then wind up. No questions, fine. So we'll wind up. Thank you.